Hi, I'm Lisa Haisha here at the Soulblazing Sanctuary, and I'm interviewing Philip Battiade. He is the creator and founder of Infuso Concept. And the reason I am interviewing him is because I happened to stumble upon one of his lectures, a wellness lecture that he did a couple of weeks ago. One of my close friends invited me, and I'm a hard sell. And I went in there a little, who is this guy? Because I have my own method of wellness that I practice that really works well for me. And I just finished doing an in-depth physical at this place, CHLI, that they take 3 days to do it, and you spend the night there, and they do, 30 blood tests. They put you in a bod pod. They put you on give you a cardiogram, echocardiogram, heart test, everything. And then I went to see Philip speak, and they hooked me up to this machine with little electrodes, and his assistant read what it said about me, and it was almost the exact same thing as 3 days and like $5,000 worth of medical bills, and I got it for free, basically. I didn't get to sit with Philip and discuss it, but that'll come later. But I was impressed with how did it read so much in my body with 6 minutes of just sitting there. It didn't hurt, no needles. I hate needles, nothing. And I was impressed. And I said, I got to meet this guy, I got to interview him, and I have to introduce him to all my friends. So here he is, Philip. How are you?
Oh, great, thanks. Yeah, great to be here. Thank you very much.
Yes, I'm so excited to have you here because I'm a huge fan of preventative medicine. I hate medicine. I hate hospitals, and when people get sick, then, here's 100 meds to take, and you're on this for the rest of your life. So please share with us, who are you? How did you develop this concept? How did it come about?
Was so much to tell you. How did I develop the concept? I think the main thing was I was just sick of seeing patients that were sick. They'd have these mystery diseases for a long time. They'd see many doctors, but they just weren't getting better. And for me, that was a reason to look into why not. Because the patients, they were seeing good doctors, so it wasn't bad medicine. There was just something wrong with the system that wasn't allowing them to get better. They'd come, they'd have pages and pages of diagnostics that they've been through. They'd have, as you say, 100 different supplements that they're on. And it's like, why isn't this working for them? We've got to change something. So I looked into what factors I could change, basically. And the first thing I did is really just take medicine out of the doctor's office. I thought, these poor people, they've been sick for so long, they get into this routine, they go to the doctor, they wait an hour in the waiting room, they know they have 5 minutes to speak to the doctor, they're nervous, and then those 5 minutes they have to explain like 20 years of their past life. And
yes,
it's just a horrible situation for patients. And I know for me, as a patient going to a doctor, I feel the same way too. I'm just nervous, I'm just not quite sure, it takes a while to get your thoughts together. So I thought we could just calm everybody down, that might actually help. And then there's another side too, as a doctor, the whole day seeing patients in 5 or 10 minute, routine, it's boring. And so that affects me as well. That affects do I really want to sit here and listen to this? I've heard it 20 times today already, and it's like, So the idea was just to change all of that, because that puts us on a whole different footing, basically. So we took medicine out of the doctor's office and put it into a spa-like ambience. And I found for me, that was wonderful. It was so relaxed just to work like that. And for my patients, it put us on a different level. Now we were on the same level. So I kind of broke down these typical doctor-patient roles.
But how did you find or create this machine? And how long did you test it? How did you know it worked? How did that come about?
Oh, the diagnostic machine.
Yes.
Yeah. Well, I didn't actually create that machine. That machine is called Global Diagnostics. It uses a system that was developed by a physicist. I was very interested in his work, and I followed it for a long time. I think about 8 or 9 years ago, his machine came out, and so I just started to use it and test it and see how it worked. It's called vital field therapy. So what it basically does is the machine puts a very low current into your body, and it changes the amplitude and the frequency of that current, and can see how your body itself is utilizing energy. Okay. So it can see how the organs are, if they're doing repair work, or they're trying to do repair but it's not getting resolved, and you see a lot of energy is being used there. So it measures over 1 million points in your body, and we can see that on all the graphs, exactly kind of what's going on.
Yes, I was really impressed with seeing the graphs,
right.
Telling your cholesterol, fat percentage, everything.
Right, yeah. And it's a great show and tell, I must say, for patients, because they can understand it too. Once I start to get into
very clear.
To explaining it, it's very clear for the patient, yeah. it's a nice thing too, because we can see areas where maybe the body has just got into a state where it's just blocked. You know, it's not getting better, not getting worse, it's just stagnant. Yeah? And unfortunately, that's a situation that many patients find themselves in. You know,
so how do you treat patients if you don't give them medicine?
Well, I do use medicine, but I try and keep everything as non-toxic as possible and as non-invasive as possible. So my concept, the infusio treatment concept, has to do, as I say, with taking medicine out of the doctor's office. So demedicalization is a big factor with us. And surprisingly enough, just that works as medicine. Yeah, have the patient in a very relaxed state. All of a sudden, things work much better for them. Yeah.
Yes.
Then I like to use lots of infusions, or IV infusions of natural substances, things like vitamin C, calcium, magnesium, amino acids, just basic building blocks to build up the body and give someone more resilience, basically. Yeah. And then a key factor in our treatment is looking at the immune system. And we don't just boost the immune system, because if an immune system is not functioning properly, usually that's because the ratios of the immune cells have been skewed somehow. So if you just boost the immune system, you have more cells, but that ratio is still skewed, so you're not really changing anything. So we do something which we call immune modulation, which is basically changing the ratios of those cells, and once you do that, the immune system kicks in and starts to do its job. So it's a very foundational therapy, but it's an extremely effective therapy.
How do you boost people's metabolism? Because I found that to be really a problem, especially with women over 40.
A main part of our therapy is thymus therapy, which is part of the immune modulation. We know the thymus gland, it programs our immune system, but the thymus gland also has a lot to do with hormone balance and with our neurotransmitters. So by doing thymus therapy, by doing the immune modulation, we actually repair the function of the thymus gland, and that in turn helps with hormone balance and the balance of neurotransmitters, and that in turn helps with the metabolism. So it's kind of a very foundational thing, but it has a chain reaction of healing in the body, basically. Yeah.
Okay, so who are your patients, and where do you have offices? Are they all walks of life, teenagers on? Are there toddlers to, centurions?
Yeah, it's basically everybody. I must admit, I don't see very many children. It's mainly, I would say, starting mid-20s, early 30s. I see a lot of young women in that age range. Many young women have problems with either polycystic ovaries or other autoimmune things such as lupus, fibromyalgia. We see that's a typical patient group. Men I usually see once they get into their 40s. That's when testosterone levels go down and things like that, so they're having different problems in that area. A lot of young men I see have problems with depression, just not feeling good, not being able to perform the way that they should do. I see these people.
And what do you give them for that? The infusions?
The infusions, immune modulation.
So you figure out what their body needs and how much and how frequently? Like if someone came in, say a 40-something came in with depression, a male,
right, yeah.
Since we just talked about a female, what would you say?
What would I say? Well, first I would do my global diagnostics, because that would give me an idea of what's going wrong, because just not feeling good, just having depression, usually that's a symptom of something else. So I'll look and see, what can I do there? And then we have some foundational treatments, immune modulation, fixing the thymic function, so that will balance the hormones and neurotransmitters. If I just give the body a boost with just, as I said before, just general vitamins, minerals, amino acids, that is sometimes enough just to fix the problem. Yeah, so I'll try that first, and if that doesn't work, then we'll go more into detail. Yeah,
because I work with people as a life coach and a counselor, and I help them with mind, body, spirit. And so many of them have been on medication for 20, 30 years of, depression, Prozac or ADD, anxiety are huge factors in most of my, patients or clients, whatever you want to call them. And how do you work with them?
Well, that's where our body work plays a very large role. As a student, I was looking into movement systems and what they do to our body. We always talk about mind-body medicine, that the mind affects our body. But I think there's a step before that as well, because everything we think, everything we feel is really chemistry. It's hormones, it's neurotransmitters that are released in our body. So really it's not mind-body, it starts with body, which affects the mind, which affects the body. So I was looking into movement systems, body systems that we can use to basically stimulate the right combination of neurotransmitters, hormones and things like that to get the chemical balance back in the brain.
God, I love that. Body, mind, body.
Yes.
Yeah.
And that's where we develop what we call body work. Yeah. So a lot of it also has to do with good communication. So I'll talk to the patients. I always say real healing can only happen if we're truthful to ourselves. So our You body work talks about the 3 Yous. We have the you that you want to be, and that's kind of how we envision ourselves to be, and sometimes we put in a lot of effort and energy to get there, even though it might be unrealistic. And then there's the you that other people see us as and treat us that way, which forces us into a role as well. But in between that, there's the real you. That is the you that we really know in ourselves. Yeah? And sometimes we don't want to admit it, because that's where our weakness is, that's where our jealousy is, that's where, you know, all these negative things can be there. There's a lot of positive things there as well. And so real healing, I say, can only happen in the real you. So part of my therapy too is just basically talking to patients and getting them to recognize, you know, who am I really? And I find that is very profound for many patients. Once they get to realize that and get to appreciate themselves and learn to feel themselves and perceive themselves, that's when they're in control of their life.
Yeah, and that's very tricky. That's part of the therapy I do with patients, is really I do something called soul-to-soul therapy instead of mind-to-mind, because I don't think you could, kind of same concept, I don't think you could fix someone mind-to-mind because they're in their ego, they're not into the, their true you. You know, who are you really?
Yes.
Once you could get them into who are you really, that's when the tears come, that's when the healing starts to begin. But it's very hard to get someone there. A lot of my patients say, oh, I've been in therapy for years and it's so great to meet you, because it's hard to open up to someone. So I found that with you, when I first met you, you were so open, and you were, I don't know, something about you was easy to communicate with, even though it was a little chaotic because there's so many people there going, I need to talk to Philip, you know, pulling on you, but you still kept the space open to make each person feel important. You know, you said, oh, I'll be with you in a minute, let me finish this up. And so right away I go, oh, I could talk to him, I could trust him. So what is that? How do people find that in their life, or why don't other doctors do that?
I must say that is part of my personality. That's just how I am. And it's something I've tried to translate into my concept. And I do find with my staff, I train them to be able to be like that. And that's when I first come to realize how many people have just trouble being open. Why aren't other doctors like that? I really don't know. I think a lot of it has to do with, you have to protect yourself if you're a doctor or if you're in the medical field. You don't want, you know, your patient's problems coming onto you. And also, for many doctors, medicine is a job. You know, you go to your office, you do your job, and you go home. Basically,
And they're stressed out, and they're overworked,
and also doctors have a private life, so maybe they do have problems in their marriage. They have stressful children. They have financial problems. So these are all things in the background that, as a patient, you don't see. But that's where his mind might be, while you're sitting there and he's hearing for the 20th time, you know, that you're having trouble with your blood sugar, and he's heard that all day. You know, his mind's somewhere else. So I think that really does affect the way, you know, a doctor can open up and actually, you know, deal with patients.
Yes, I have a cousin who's a doctor, and I went to visit him a few months ago in San Diego, and he had about 20 people in his waiting room, and I said, why are you sitting here with me? He goes, it's okay, they could wait. I'm like, but there's 20 people there. How long are they going to be waiting? He goes, oh, some of them wait 2 hours, 3 hours, because I don't know. He goes, but usually everyone's 5 or 10 minutes, so I could get them in and out. But I back them, you know, I really book them every 15 minutes because people are late and I don't want to wait. I'm like, but what about them? They're waiting, and what, you're 5 or 10 minutes, and if there's that many people waiting, he's going to be a little more, you know, come on, chop, chop, what's your problem? Oh, you have depression, this. Oh, here's a pill to take, here's this and that, you know. Here you go, you're good, you know what, call me. Next, you know, and he could get through it. He goes, no, I could get through it, it's okay. So how's your dad doing? And how's that? Like, what? You got people out there. And I was more stressed about them, but he's just like, so I think he's been in practice for a long time. So I think you're right that doctors are just, sometimes I'm just so exhausted by seeing so many people, and let me give them whatever the pharmaceutical company says, if you sell X amount of these, you get more money or whatever. So I love the idea of going to your office and you get to actually, it's not an appointment, it's a meeting. You're coming to share time with you. It's not about, I'm the doctor, you're the patient, and sit there and you're in your white coat, and it's very, you know, it's like, I want to know you. Now once I understand the 3 U's, then let's prescribe what you need. Let's see what it is. Is it a mix of certain meds and infusion, or is it infusion, or is it, I also heard, or you told me, and your assistant, I believe, told me that they also could take home treatments and give them self-shots.
That's right. Yeah.
Yes. Will you share a little bit about that and who would take them and why?
Well, that's our immune modulation with thymus extracts.
Oh, okay.
Yeah. So that's usually a course of 15 applications.
In a row, 15 shots every day, or one
no,
a day?
We do, for the first 5 days, it's one a day, and then for the next 5 weeks, it's twice a week. So it's 15 shots over a period of about 6 weeks. So in Germany, we do that as an injectable. Here in the US, it's actually an oral supplement that people can take. You put it under your tongue and just
But
let
is
it be
it
absorbed.
as effective?
It's not as effective as that way. So, you know, if patients do want to inject it, that's completely up to them. We produce it as a sterile injectable. That's how we import it. But we can't label it as such because then it will have to go through drug trials and things like that. So it's a matter of personal choice how it can be taken.
How effective is the oral?
To be honest, I really don't know because I don't know any of my patients that have taken it orally, to be quite honest.
What about tests that have done to even make it something that people can?
Well, in Germany, all the studies have been done using thymus as an injectable. There's over about 30,000 case studies in the use of thymus extracts. Here in the US, I haven't seen any studies up to now about the oral use of thymus. Maybe there are some, I'm just not familiar with them.
Yeah, but if they did create it, didn't someone do a study somewhere?
Really
if they did, you don't know.
I
You
really
just
don't
said,
know.
okay,
Yeah,
it's available.
I mean, we do know that the peptides, so these chains of amino acids, they can be absorbed through the mucous membrane. So if you keep it in your mouth long enough, a certain amount will be absorbed. But
Okay,
yeah.
okay, but you would recommend injectables?
I'd recommend injectables.
Yeah, because you
yes.
know that for a fact.
Yes.
Okay,
Uh-huh.
okay, fair enough. So this is a legacy series, and what I'm trying to convey to the audience is so many people are out there, either part 2 of their life or they're just getting started, and they want to know, how do I get my passion, or how do I create something that I love to do, or I want to make a difference? How did you come to doing what you do, and how did you turn it into a successful business that you enjoy and helps other people?
Well, I come from a family who are they're very forward-thinking. They're very out-of-the-box thinkers. And my grandma would always tell me, you know, everything is possible. There are absolutely no limits in life. It's just about the effort that you put into it and your mindset to do it. So I've grown up with that thinking. Yeah. I had this idea and thinking, okay, well, I've got to change some things. It's not, for me, it's not about changing medical knowledge. Medicine is good. It's about changing everything around it is what I want to do. I want to form like a sleek kind of medicine that patients can really relate to. And
Okay.
that was kind of my thinking, you know, how can I do that? Because
But did you have an illness or anything, or did anyone in your family, and did you go through the whole medical, I don't know, traditional medicine way of where you had to go get diagnosed, and were you frustrated? Did you get a false diagnosis? Were you hospitalized?
yeah, I must say I'm one of the very fortunate people that didn't really go through many obstacles or have many obstacles like that. Of course, I had to go to the doctor now and again, and it was never pleasant.
But what was like the seed of, oh, I want to help people in the medical field, and I'm going to go through all this education to get there? And
It was more family tradition.
Okay.
I come from a family of doctors and lawyers.
so you're
and
just inspired by who your parents were and your family?
Yeah.
Okay.
To be honest, I never really wanted to get into medicine. I'm a musician. I love music, so I actually studied music. But my family insisted that I basically, you know, deal with medicine as well. So I got into medicine as well and developed a passion for it, basically. So I used to play the viola, so I used to play in an orchestra. But then at some point in my life, I decided, okay, I'm going to change. I'm going to change my path. And I got back into dealing with medicine again and just started to develop my treatment concept. And that I really enjoyed. And for me, it was about helping people. I could see, as I said before, so many sick people that really need a different kind of support than they're getting at the moment. So I'm not going to, you know, change medicine, but maybe I can fill that gap that's there. And that's been my passion, to be able to do that.
Can you tell me about a client that was probably, or a patient that was your worst patient that had a lot of illnesses or a lot of things wrong with them, and what you did and what the result was, and how long the journey took?
Well, I have one client that was actually quite recently. She had a seizure and was very sick after that. She was hospitalized for quite some time. She was then diagnosed with epilepsy and given all the medication. Unfortunately, the medication had so many side effects with her, she wasn't able to perform in the way she was. She was also in entertainment business, so it was important for her to be, you know, spontaneous and witty and things like that. And the medication just didn't let that happen. Yeah, so she was given other medication to kind of help with that, but then because of that she couldn't sleep, so she was given medication to help her sleep. And so this whole...
That's so normal.
Exactly.
Everyone, yeah.
So this whole concoction that she was taking basically put her in this really weird place. I know the first time I met with her, I thought, this woman's crazy. You know, I just, she was all over the place with her thoughts, couldn't really speak clearly, and it was just like, whoa, you know, what's going on there? But then one time she approached me and said, you know, I need help. I just cannot continue in this way. So she came to our clinic in Frankfurt, Germany. She stayed with us for 2 weeks. After day 4, she actually gave us a little video testimonial. Completely different person. Yeah, within 4 days we got her off all of her meds. We did our diagnosis and find that we couldn't find epilepsy, but we found that she had Lyme disease. We treated her Lyme disease, and she
with the infusions.
With the infusions
Okay.
that we do, yeah. We also do stem cell therapy, autologous stem cell therapy. So we use that as part of the regimen.
What does that entail?
Autologous stem cell therapy entails, well, we take some blood, and from that blood we can extract stem cells. You know, we have stem cells in our blood. So we do a large blood draw. We can extract about 300,000 stem cells. In our lab, over the period of about 8 days, we multiply those stem cells. So after about 8 days, we have about 4 million stem cells. Yeah. And in the meantime, we are giving the patient IVs, we're fixing their immune system, giving a detox, kind of preparing them. Then after that 8-day period, we give the stem cells back.
How do you detox them?
Detox also through our IVs.
Okay.
For example, also some nutritional things we'll give them. Some patients might have colonics as well. So there's a whole range of
Okay,
things we can do.
wonderful. Yeah, I know Colonics is a great detox.
Right,
You know,
yeah.
juicing greens, water, and Colonics, that alone.
Yes.
You know, yeah.
That's right. And then just
Okay.
a few IVs as
So
well.
they just stay there, and you do your thing.
Do my thing, yeah.
Detoxing and making them healthier, and then you...
Right, yeah.
Oh,
So with the patient, after 10 days,
wow.
it completely turned her life around. She said, you know, Phil, you have saved my life. And she's off all her medication, leading a completely normal life, back in the entertainment field, just her career's going crazy at the moment. And she's great, she's fine. There's no follow-up, there's no home program.
That's
she's
wonderful.
fixed.
Yeah,
And
yeah.
that's wonderful
In 2
to see.
weeks, and that's it.
That's right, yeah.
So, are you ever afraid that you're going to do something on someone, especially someone who possibly had epilepsy, that they might die in your office, or you might do something that's catastrophic and they're going to sue you, or how do you deal with that stuff?
Well, I wouldn't say I'm afraid. I mean, there's always a risk, and you have to have, there's a certain amount of respect.
And there's a lot of
There's that.
crazies who are just sue happy.
That's
too.
true, yes,
Yeah.
yeah. But I do find the kind of patient that feels comfortable with us is usually not that kind of patient.
Okay.
Yeah, these are patients that are willing to take that risk. They're willing to think out of the box, take that step outside of mainstream medicine and try something new. So that kind of reduces the risk of that. But there's always patients, of course. You know, I've had patients that have traveled to me from the US, they've come to our clinic in Germany, the day after they got there, they died. You know, these things happen, yeah. And that is the reality of medicine. So being in medicine, you can't be scared of that. But of course, I have to make sure that I'm doing good medicine. So I
And
can't
do you
ignore
watch
the
who you
facts.
take? Like if someone came in and you really thought they were psychologically off balance, would you say no?
I do say no sometimes,
Okay.
yeah. I would say psychologically imbalanced is not my prerequisite. I need to really see that somebody is open-minded, they're open to change, open to recognize their own responsibility that they have in getting well, and open to think out of the box. If I see those factors, then I'm willing to take on any case. And even if it's, you know, end-stage cancer where I really can't do much, it might just be about improving the quality of life until someone dies.
Yeah, if someone has stage 4, is that hard to cure at that point?
That's the question I'm often asked, stage 4.
Yes.
You know, I'd say most of my cancer patients I see are late stage, you know, stage 3 or 4 cancers, because they've been through the mill, they've done everything else, and now where that's not working,
Come to you.
now suddenly they're, you know, willing to think out of the box. Again, with those patients, I must say the main deciding factor for them, I find, is their mindset. Many patients, especially with cancer, you can see there's a lot of problems in the background as well. In fact, there are some investigations, there's a form of German medicine too that looks at specific stress factors that trigger specific kinds of cancer. And we often see that correlation there too. And if patients are willing to change their mindset, if they're willing to solve those things or approach those things, these are the patients that do best. So it's difficult to say, you know, stage 4, how well can you treat her? It really depends on how that patient is. if we, you know, if we can turn them around or not. But it's definitely possible, yes.
Okay, so what do you want your legacy to be?
What do I want my legacy to be?
Yeah.
Well, I really want to, let me say, change the face of medicine. Yeah, I'm not going to, you know, come up with some brilliant research and, you know, something mind-breaking or mind-boggling new thing in medicine. I'm not going to do that. But I'd say kind of like Apple, kind of like Steve Jobs. Yeah, he took something that we all have, a telephone, and it's still a telephone, but he completely changed it. He took off all the frills and everything and made it into this super high-tech thing, but packed it in a really simple box. Yeah? And that's how I want to do medicine. I want to have really high-tech, cutting-edge medicine, but I don't want that to be in my patient's face. When they can come into my place, they just should see normal people, nice spa-like atmosphere, but in the background is where all the high-tech's happening. Yeah, and it's simple. With a, you know, an iPhone, it's one button. That's how I want my medicine to be.
Okay.
Very simple, user-friendly. Which, of course, there's a lot of education that I need to do. The patients need to be educated in the way we do things, you know, so they have confidence in what we're doing. And they're assured that the real science is actually behind that. But I want to change the way patients experience medicine, because I really think that that will change the outcomes for them.
Okay, and how is the difference between, or what is the difference between working in Europe and United States?
There's
Asia?
a lot of difference.
Yeah.
Yeah, there's a lot. Well,
a lot more red tape here, or?
There is a lot more red tape here. But I find here in the US, it's mainly the mentality that's a problem. In Germany, where we have our clinic, a lot of patients are looking for complementary medicine. Every doctor in Germany is trained in using some form of complementary medicine, just simply because patients want that. In Germany, if I was to prescribe someone antibiotics, they would probably refuse and say, well, what else can I do instead of that? And try everything else until we get to antibiotics. Here, patients go to the doctor because they want to have antibiotics. You know, I've got a cold, let me take some antibiotics just in case.
Yes, yeah? Yes.
And I was actually reading a study about that, I think it was, there was a few states in the central USA where every person had received at least one treatment with antibiotics in a year. Well, that's shocking. There's millions of people.
Yes, yeah. Yes.
I think in California, it's every 6 out of 10 people receive antibiotics every year. Yeah, there's something wrong with that.
There is. Yeah. So many of my clients come in and say they're on this, and this. And I was going, I want to send them to you. How do you get people off the need, or that they're told they have to do it, otherwise they're going to die, or their life is going to be, you know, 30% of what they know it today. There's got to be another way, and I think you're the other way. Yeah.
The interesting thing with that study, though, well, what came out, it wasn't the doctors. It was the patients wanting antibiotics.
Yes.
Yeah.
They do.
And that's the difference I'm seeing here, that the patients have a certain expectation. This is the way they want their health managed. And then, of course,
it's easy to take a pill and they don't have to exercise, they don't have to drink wheatgrass or get colonics or get shots, infusion. Yeah.
That's it. And that just doesn't work.
It doesn't work.
That's the bottom line. And so that's why we want to bring in a lot of education and see that you have much more, you are much more empowered, really, to you know, live your life. Another thing I like to say is stop managing your health. Yeah, we have all these health problems that we have to manage. It's kind of like nursing a baby. You're going to have it with you all the time if you're managing. Yeah, one of my little taglines is, you know, stop whining, get healthy. It's just
love that.
Yeah, it's just you know, life is what it is. We all have a headache now and again. We all have a cold now and again. We all have a stomach upset now and again. It's not the end of the world. We don't need antibiotics. We don't need to run to 3 different therapies just because it's just life. Yeah, stop whining, get healthy, enjoy what you have, focus on that positive side of life, and you'll find that those negative things will be much less and have much less impact on your life.
Excellent. Thank you so much.
Oh, you're welcome.
I really enjoyed this, and I think a lot of people will benefit from hearing about you and going to your clinic. So can you tell me where it is?
Yes.
The address is going to be in Beverly Hills, I do know.
Yes, that's right. We're opening now in 435 Bedford Drive in Beverly Hills. We have our temporary office is already open there, but our main office is going to be in the penthouse on that building, and that should be open mid-August, beginning of September.
And what's your website?
Our website is infusio.org.
Okay. Thank you so much.
Thank you.
I appreciate it.
It's a pleasure being here. Thanks so much.